Welcome to British Association of Dental Nurses podcast, Voice of Dental Nursing. Delve into the world of dental nursing and beyond with us. Sit back, relax, and tune in for engaging conversations. Let's get started.
So, welcome back to the BADN Voice of Dental Nursing podcast. You must know me by now. My name is Preetee Hylton, and I am your host and current president. Today, we have someone very, very special. She is a dental nurse, and she's also one of our BADN reps. So, we've got Lorraine Dignwall. So little bit about Lorraine. She's got beautiful pinkish hair, which I love. And
The British Association of Dental Nurses members are eligible for free dental nurse membership with the Association of Dental Implantology, ADI.
Lorraine started dental nursing in 1999 in an NHS practice, and at the same time she was completing her national certificate in dental nursing. She successfully completed this in 2001 through night classes, and we will go through this a lot more because that sounds quite challenging. And then back in 2001, she went on to work in a private dental practice, mainly doing implants and cosmetic procedures. And then she took a break in 2018. Again, we will be talking about this a lot more. But went back to another private practice setting in 2018, and then she obtained her BDA radiography qualification in 2022, and she recently completed her implant nursing qualification as well. And speaking to Lorraine, she holds quite a strong belief in the power of collecting support, which is why she's our rep. But enough of the sound of my own voice, because this podcast is about Lorraine. So, Lorraine, this was a very brief introduction of you. So I'm very curious, like, how did you, first of all, night classes to complete your qualification?
Yeah,
I mean, how was that?
well, I really enjoyed the night classes. They were on a Wednesday night, and we would go through, there was 3 of us, we'd go through every Wednesday night after work from, I think it started at 6 and it finished at like 8:30.
Ooh.
But it was I really enjoyed it because there was a practical section that you would do, and you would do spotter tests and mixing stuff and you know all that bit, and then there was also the theory part, and it was really nice, but it was together. I've noticed a lot of the time, if the girls are maybe doing their booklet or something like that, a lot of the time they're doing it on their own, and so I really enjoyed the night classes because we were all together and we were all in it together.
Oh, very nice, very nice. So what prompted you to go into dental nursing?
So I will fully blame my mum because I wanted to do medicine, but unfortunately I was really ill at the end of 5th and 6th year. So I failed all my exams. I didn't get what I needed, and I kind of just didn't know what to do. So I got a job in an office, I think it was. And then my mum was like, oh, there's this job going. It's dental nursing. You should give it a try. And I was like, all right. But
it's just all right.
I know, I was like, all right, mum. And for a long time, I didn't want to say that I loved it because I thought that was really geeky or I don't know, but I do. I love it, and I love working with the dentists, and I love the other nurses. It's something that I really, really enjoy. So that came out of me not passing my exams.
Well, you see, there you go. You're quite a successful dental nurse, aren't you? You're quite well known wherever you are.
I'm the one with pink hair and the pink Crocs.
BADN members have access to free CPD in our quarterly digital journal, in our CPD portal, our online coffee catch-ups, and to our downloadable CPD activity log and professional development planner.
No,
And a
you
little
look
unicorn
beautiful.
badge. Oh yeah, I enjoy those things. I like the radiography I really enjoy. And I enjoy knowing what we're doing and why we're doing it. So the extra bits I think are really important. And I think it's important for the younger nurses to see us doing that as well, so that they know they can do that and they have that like belief that they can achieve that as well. It's not just one person or the other person, it's all of us together. And the more we do that together, then the more we can collectively show our skills and show how we can progress, and that it is a really skilled job and we do know a lot, and it's really important for them to feel that, I think.
It is actually. And can you just walk us through like a typical day um, in the life of you at work currently? Because I know you're doing extra bits as well,
So
which is very
yeah,
exciting.
so I've kind of transitioned at the moment because I was where I was working. The round trip to get to where I was working was 54 miles, there and back. So I've
Oh
got
dear God.
four kids, three of them are at home and two of them have got school. So I drop them off first thing in the morning, one way from my house, and then I would drive back the other way to go back to work. So it would take me about an hour and maybe 10 minutes some mornings just to get to work. So then I would do that and then I'd come home and do it all again. So I've transitioned at the moment. There was
As
a
part
job
of
at a
our commitment to
pharmacy, doing
supporting the
pharmacy
professional
dispensing,
development of
where
dental
I stay.
nurses,
So I
the British
took that on,
Association
but
of
then I've
Dental
also
Nurses
taken another
members have
job on
exclusive access to the
at a dental
BADN job
clinic just up
board.
the road from me. So
This
I'm not
platform
starting that
highlights
till
a
May
range
though.
of dental nurse job opportunities, helping members explore potential career paths and take the next step in their professional journey.
Wow. So how I don't think it's the right question to ask a lady, but how do you balance all of this in terms of you've got work, you've got a family, and you clearly believe in enhancing your own skills. How
Mhm.
do you do it? My gosh, you're like Superwoman.
Oh, that's very sweet. I do it because I think I do it because I want to do it. And I think there reaches a point where you do these things for yourself, but it's also one, to show my kids that I can do these things, and two, that other girls that I work with are really important to me, and I want to show them that ethic and that you can achieve things and it doesn't have to be hard and you can support each other. And I think it's more of a self thing rather than a like, ooh, look at me, what I can do sort of thing. It's not anything to do with that. It's more of a group like achievement thing for me. Like if I'm in a practice, it's not like, oh, I've done this or I've done that. It's we're doing this. Anything I do just makes it better. Anything you do makes it better because we're all in it together. One bit doesn't work without the other. You can't have one bit better than the other or one bit worse than the other. It all just has to work together. And if I can do something that maybe makes somebody else feel better, or maybe thinks somebody else can be like, oh, I could do that, or like, or she's had a rubbish day, but she's still smiling and she's still like, trying to keep everybody going, then it just makes everything a bit better. And it's just that tiny little thing that might make somebody's day, or it might make something better for somebody, or it might make the patient have a nice day. And it's just a thing that just keeps me going. Like that might make something better.
That is, can I say, that is such a healthy mindset to have. So we're delighted to have you as our rep.
Oh, but
But
well, I'm very privileged.
but what made you what made you become a rep of a representative of the BADN? I mean, I can see now that I'm talking to you, like
Uh,
you really are into other people, your colleagues, perhaps close ones as well, for them to grow and develop, not just professionally, but personally as well. And
Mhm.
that shows. So what made you become our representative?
I was looking for something that I could do, and I was sort of searching about, and I was like, oh, there's not really, if you go searching for things for dental nurses, like communities or groups or anything like that, there isn't that many. There's not that many things that sort of promote us sort of sticking together and like fostering this sense of like, oh, I've done this, look, I'll pass this on to you, you could do this, or like, like this network of a network of nurses, because we don't get together anymore. We don't have that bond. And if you work in a small practice, it's maybe harder because there's maybe only two of you. So, to find something that could foster that and to bring that into the practice and to bring that into other nurses, I think is really important, because otherwise you do get people leaving, or you do get maybe younger girls coming, or boys coming and joining and not realizing that they could potentially go on and do their implant exam, they could do their radiography, they could do digital scanning, because you have to go looking for those things. But if in the BADN, you can pass those things on, you can say, oh, this has come up, or like there's a coffee and catch up, there's the one about the dental nurse that owns her own practice and owns
Yes,
her own lab. That's amazing. I went back to work and I was like, look, we could do this, we could do this. But it's just finding these things out. So
absolutely. It was Rachel Dilley, wasn't it? Owns her own practice, and I thought, oh my God. But yeah, she's amazing as well. You clearly are like a girl's girl in a way.
yeah.
Especially when it comes to dental nurses. But what do you think? What's the future for dental nurses at the moment? Because we still have the issues around the topics of wages, treatment of dental nurses, this lack of appreciation and growth perhaps in the profession. So how do you think, where do you think we stand, and where are we going in the future of
Yeah,
dentistry?
I know. I mean, I am obviously quite a positive person, so it's not that I'm denying any of these things here. And that is one of the things, one of the challenges that makes it so hard, because you might get somebody that does an extra qualification and they don't get recognition for that. And they might not be at a position of their own self-esteem or their own confidence where just passing that exam is enough. They might be, well, why am I doing this if nobody's even recognizing it, or nobody's giving me the accomplishments that I've done? It could take a year, it could take a year, like 2 years, and then nobody acknowledges it. And that is hard. And I think that's so sad. And that's one of the things that I don't want happening to any of the girls coming up, or somebody coming into a new job, in it. And I think it comes down to us all, I don't want to say sticking together, but even at conferences or stuff like that, if we're all there together, then people can't ignore us. It's like
That's true.
we're all trooping in and like being like, well, you need to speak to us now because we're all here. And it is fostering that sense of we can do it. We can all stick together. But it is a challenge, because I know it's disheartening, and it's there's so many things that you can see and be like, well, that's not right. But then it's hard to come at that by yourself. So if we're all together and we know that there are things out there for us, like there's heaps of digital dentistry courses for nurses, which is like another layer onto that. But until we go out and try and find them, it will stay in the background. And it is that sense of like trying to get us to speak out for our own selves, and for everybody else, because otherwise it does go unnoticed and people will leave. They'll get fed up and just be like, oh, it's not worth seeing anything, I'll just go, or I'll go do something else. And that's sad, because it's a really important job and it's a really skilled job, and to lose people that are unhappy is something that I would never want to happen to somebody, because it's not necessary, but I know it happens because there are so many challenges, and it does make it difficult. So I don't know if the future is that we all just band together in one big group and just but I think it's also things like this. This makes us have a voice, and it makes it more accessible, and it makes things maybe more possible, that we can speak out about things and we can say, look, we've done this course, we've done this course, we've done that course. What else are we meant to do? Because it's a lot of work.
It is, and it's about having that incentive, isn't it? Like, or having the opportunity for dental nurses to be able to use the skills and the courses they've invested in. So what advice would you, because what happens is, like, if you're not appreciated enough, or you tend to get like, you feel stagnant in the profession. So what advice would you give to any of the dental nurses, whether they're newly qualified or whether they're quite experienced? Like, what advice would you give them if they start getting that feeling of, well, I'm not going anywhere?
It's difficult, and that feeling is sad, and it can make you almost feel like you're walking through mud or something, like you're trying your best, but it's just like you're being dragged that way, and you're trying and you're trying and you're trying. And either if you've got really good people at work, because a lot of the time in dental practices, that's one of the things that I love about them, is that people are supportive and you do get form close friendships with people. Just speaking to somebody about how you feel can sometimes help, and it might just be that that's maybe the area of your life that you're in at the moment. You feel a bit stagnant, you feel a bit and you don't know where to go. Or try looking for things that you enjoy through dentistry. Might be a bit different. That might be like, I send random emails to people all the time. I'm like, hey, do you like to do this? Or like, let's do this course. This would be fun. But I know that's not always easy. Sometimes people won't speak up, or they won't feel comfortable doing that. But a trusted friend, or even like a trusted dentist or colleague that's maybe got your back, and they could help you speak up if you're not that good at it. And then sometimes maybe it is a change. Maybe you need to look at different positions, or like different skills, or I think is it the Skills Network? They do a lot of actual free courses, and you can do like is it I think there's a heap of like online ones you can do, and there's like digital ones and things like that. So it's trying to find something that gives you that sense of feeling that you are accomplishing something, or receiving support, or sometimes maybe it is looking for where you are going to be appreciated, because sometimes it feels like you're not, and that's not, and you're not wrong for feeling that. And sometimes if you've tried and tried and tried and tried and tried, there's only so much you can do.
Absolutely.
So it's
BADN members have access to our legal helpline for free legal advice.
balance.
It is. It's about making changes, I think, in mindset as well, like, for dental nurses, but also for employers as well, because like you said, we are skilled professionals. And if you had the power to change things in dentistry, which would make a positive impact for dental nurses, like, what would you do?
I would, if there's courses, and I've thought about this a lot, if there's courses running for the dentists, then run one alongside for the nurses. Because if the dentists have spent so much time learning these courses, which we appreciate, but a lot of the time when they come back, they don't have time to tell us
Mm-hmm.
what they've been doing. So we're sat there just trying to help them, not knowing what's going on. But if you run a course alongside with the dentists for the nurses side of that course, the practice will run better when they come back. The
Yes.
nurses will feel appreciated because they've had their own kind of day. And also the nurses are then networking with each other, with all these other dentists. So then you've got the two joining together, which is how it works. Because you have
Yes.
to work like that anyway.
Yeah, because you have to have that team approach. So if like a
Okay.
clinician is on a course,
Uh-huh.
have their dental nurses there as well, because they're learning the same thing, but to make their lives better, or even the
Uh-huh.
patient pathway in the
Okay.
practice,
Uh-huh.
much easier, like much I wouldn't say enjoyable, because I don't
Mhm.
think patients enjoy being on the dental chair, but it would make it much more comfortable as well, because
Yeah.
you have that trust. Like, okay, I've learned this, but my dental nurse was there as well. She's got the same
Uh-huh.
information. We can have a chat through it
Yeah.
and go. That is such a brilliant idea. And I know
Yeah.
some of them do it, but it's not enough, is it?
Yeah. No, and it's the same with maybe conferences and things like that. There will be ones on that are solely for the dentist, which I get. That's but then you've just excluded half of your team.
Yes,
that is that is your team that doesn't run if they're not there. So
absolutely.
it is just about including everybody. So I've got this thing as well about like when things are posted or whatever, or it's like a before and after, like even just a tiny little bit at the bottom saying assisted by and your nurse's name, because she or he was there. They were
Yes.
there helping you. And like for somebody that's maybe on social media a lot, maybe like I don't want to pigeonhole young people, but like they'd be like, oh look, I helped with this, or like, and it would just give them that sense of like, oh yeah, I did
Yeah.
that. Yeah. And it's just a tiny thing. And that doesn't cost anything. That's free.
Yes, yes. Do you know, I agree with you on all of this. Like, it's just like a bit of recognition, like an acknowledgement, like, okay, we did this together as a team.
Yeah.
So,
Yeah.
why wouldn't you?
Yeah.
Anyway, well, hopefully to those listening to this podcast, I hope there will be changes, thanks to your insights, obviously.
Oh, but
Um, and I was thinking, you mentioned about talking to your colleagues if you're feeling a bit stagnant, and
yeah.
this touches on well-being in the team, in the
Mhm.
dental team, in the dental practice as well. And we've both been dental nurses for a long time, and sometimes you don't even have time to go to the bathroom.
No,
You don't have time for a sip of
we're
water.
going, and then you
So
forget.
yes, you forget. You're like, how can I forget to go to the bathroom? But it
Yeah.
happens. Um, what are your tips when it comes to having um better mental health in the
Mhm.
workplace? What changes would you make?
Yeah, I do think that's really important. And the thing is as well with the dental nurse and dentist relationship, like what that is like you don't normally spend like 8 hours a day with somebody else. Like there's a long time to spend with somebody. So if you're supporting each other, then everything works better. So it is about fostering that sense of support and acknowledgement, like not necessarily even like spelling everything out, just like, are you okay? Like, is everything all right? Like, do you want me to make you a cup of tea? Like when you've got like 2 minutes or something. And it is just that sense of support, because it doesn't work without that. It's you maybe just notice somebody's a bit quiet. Are you okay? Is everything all right? Like, can I do anything? And it's not necessarily, as I say, that person's then going to tell you their life story, but they might go home and be like, oh, that was nice. Somebody actually
Yeah.
noticed that I was having a bad day. And I do think it is just about caring. Like, caring that somebody's not had a break. Oh, I'll cover you for 5 minutes so you can get out and go to the toilet.
Yes.
It's about support, and it's about
BADN members have access to our Health and Wellness Hub for info and advice on your physical, mental, and financial health.
just realizing that none of it works properly without supporting each other. Like even the reception team, they won't work properly if they feel like they're working against anybody or they're not being listened to. And it's the same with the nurses and the clinicians. It doesn't work properly without support. So I think it's not necessarily changing people's idea of it, but it's this sense of like, you are at work, you're there for a long time sometimes, you're working for maybe 2 hours on a treatment.
Mm-hmm.
This sense of support has to be there, because otherwise, if you're having a bad day or you've got stuff going on at home or there's things not right, it's going to filter through if you're not even supported at work. Whereas if you're supported at work, you could come into work and have an amazing day at work, despite all those things going on. You could come in, focus on your work, have a nice day, know that people actually care about you, want you there, are happy when you're there. It's just about engaging everybody together, because it generally doesn't work if that happen.
I agree with that. It's like you said, it's really important. It's essential to have that support, in the team itself. And you're right, if someone's having a bad day, like you can just ask them, like, are you okay? And that tiny bit of display of care actually goes a really long way. Oh, and it would be amazing if everyone in the profession had the mindset that you have actually when it comes to better mental health, when it comes to support. Can I ask, like, what is your proudest achievement in your dental nurse career so far?
Probably actually to myself passing my implant exam. I've been doing, as my thing said, I've been doing implants for a number of years, but actually passing the exam, I was very proud of myself for doing that. But I will say also being on the panel of reps, because I feel like that's really important.
Yes, thank you. And I recall when we needed an article and you were so prompt, you were so quick to actually write us an article. I was quite impressed, and it was such a lovely read. It was quite wholesome because you put together like the personal side of your life and the professional one, and it was such a lovely read.
Oh, thank you. It's just like a little, oh no, hang on, I've got this picture.
Yeah, I love the pictures. I was like, this
Oh, they were so funny. We had quite a lot of fun doing that.
Very good, very good. As we're approaching the end of this, we tend to ask this one question, this conclusive question.
Okay.
And what would be the advice that you would give to your younger self at the start of your dental nursing career?
Know that you're worthy of what you're doing, and that it's okay to say that you really, really like it and that you love doing it. Because for so long I didn't. I was like, oh, I can't say I love doing that. That's silly. But I do. I love doing it. I love dental nursing and I love everything about it. So yeah, it is just to believe that what you're doing is important. Because sometimes it's
Absolutely.
sidelined and you feel a wee bit in the background, but what you're doing is important and it is essential.
It is. Absolutely. Thank you very much, Lorraine. And thank you for your time today. I know you have a very busy day today, but very excited for this to go to be published. But yeah, thank you. Thank you so much for all your support, for being on the panel of reps, and for being you. It's such
Oh,
a
well,
delight to be speaking to you.
Join us today. Be a part of a community that understands your journey.